Hi students, today let's discuss regarding installation. So installation means it is a process by which a liquid or a medication is introduced into a cavity drop by drop. It is one of the methods in topical administration in which we can administer a medication or a liquid into a cavity by drop method. So commonly we have heard regarding the installation of eardrop. This is the picture of eardrop installation. Then installation of eye drop installation in which medicine is instilled into the eye. This is nasal installation in which the medicine is instilled into the nasal cavity. Next is we can see each one in detail. First is installation of eardrop. The definition is it is defined as installation of eardrops into the auditory canal for local effects. So, installation means the administration of medication into a body cavity by drop method. So, in case of an eardrop installation, the medications can be instilled into the auditory canal for local effects. Okay. Next is which are the purposes of doing eardrop installation? First is to soften and to remove any wax from the ear canal. So to remove any kind of wax materials from the ear canal, we can instill the eardrops. So wax softening eardrops are available, so which can be inserted or instilled. To relieve earache due to any congestion within the ear canal, to relieve that condition associated with earache, we can instill some kind of eardrop, then to produce a local anesthesia. So these are the main purposes of eardrop. Next, we can discuss regarding the equipments which are needed to deliver the eardrop installation. Mainly the equipments include a tray containing medication card, prescribed medication, that is eardrops with dropper, cotton swabs, then normal saline, gloves, and kidney tube. These are the equipments needed to deliver or install an eardrop medications. So the procedure first is review the medication order and confirm the dose, time, amount, and year to be treated. So we should check the medication order for knowing regarding the dosage of medications as well as in which year we have to instill that medication. According to the ear infections, sometimes the eardrop can be instilled on both ear or else it can be instilled into a single ear. So according to the doctor's order, we should check that medication order with medicine. So it is mainly to prevent the risk of errors. And identify the patient and explain the procedure. We should follow the 10 rights or we should maintain the 10 rights of medicine administration, and also you should explain the procedure, why it is administered into that ear, what are the indications or what are the purposes of doing such kind of procedure to the patient. Then only we get a full cooperation from the patient as well as to reduce the patient's anxiety. Then gather all equipments and warm the medication bottle, which means eardrops to body temperature, or else patient may get irritated while you are installing these eardrops. Before going to install these eardrops, we should make sure that the temperature of the bottle will be equal with the body temperature. Okay, then, and also we should gather all equipments. We have already discussed regarding the equipments needed for eardrop installation. So we should collect or we should arrange all the equipments at the bedside. Then next is wash hands and wear gloves. So first hand should be cleansed and wear the gloves. It reduces the transmission of microorganisms. Then position the patient on side lying or sitting position so that it will help to access the site very clearly and to prevent the leakage of medication. It provides easy access to ear for installation. Then clean the ear canal using cotton applicators and normal saline. Clean the ear canal using cotton applicators and normal saline. Before going to install the medication, we should make sure that the ear canal is free from contaminants. Okay, to clean the cerebral and drainage as it prevents the even distribution of medications. Where medications നമ്മൾ കൊടുക്കുന്നതിന് മുമ്പ് ear canal നമ്മൾ പേറ്റൻസ് നമ്മൾ നോക്കണം. അത് ക്ലീൻ ആണെങ്കിൽ മാത്രമേ നമുക്ക് അല്ലെങ്കിൽ ഡ്രെയിനേജ് അങ്ങനെ എന്തെങ്കിലും ഉണ്ടെങ്കിൽ ഇയർ ഡ്രോപ്പിനെ കംപ്ലീറ്റ് ആയിട്ട് ear canal distribute ചെയ്യാനായിട്ട് സാധിക്കത്തില്ല. So before going to install the ear drop medications, we should make sure that the ear canal is free from any kinds of cerebral drainage. Okay. Then straighten the ear canal by pulling auricle upward and outward. Okay, straighten the ear canal by pulling auricle upward and outward. It is only for adults. And in case of infants, we can straighten the ear canal by pulling the pinna downward and backward. First, we should straighten the ear canal, then only we can install the eardrops correctly. Or else, അങ്ങനെ നമ്മൾ ചെയ്തില്ലാന്നുണ്ടെങ്കിൽ കറക്റ്റായിട്ട് പേഷ്യൻ്റ് ഇയർ കനാലിലോട്ട് മെഡിസിൻ ഇൻസേർട്ട് ചെയ്യാനായിട്ട് സാധിക്കത്തില്ല. Then position provides access to deep ear structures. Then install prescribed number of drops holding dropper slightly above the ear. Ear drop install ചെയ്യുന്നത് ഡ്രോപ്പറിൻ്റെ പ്രസൻസിലായി ഡ്രോപ്പറിൻ്റെ സപ്പോർട്ടിലായിരിക്കും. അതായത് prescribed medications amount തന്നെ നമുക്ക് ഡ്രോപ്പ് ബൈ ഡ്രോപ്പ് ആയിട്ട് കൊടുക്കാനായിട്ട് സാധിക്കും. To prevent the contamination of dropper, we should place or we should hold the dropper at the top of position. Okay, this is the picture of how we can straighten the ear canal using the hand. In case of an adult, we can pull the ear up and back. അങ്ങനെ ചെയ്യുമ്പോൾ ഓട്ടോമാറ്റിക് നമുക്ക് ear canal visible ആവും. But in case of children, we should pull the ear down and back. In anatomical position അല്ലെങ്കിൽ anatomical length and variation അനുസരിച്ചിട്ടായിരിക്കും നമ്മൾ ഇത് change. Then next is the procedure. In that, gently insert a loose cotton swab into the meatus of auditory canal. Instruct the patient to remain in sideline for 10 to 15 minutes. It is mainly to prevent the medication from draining out and facilitate proper distribution into ear. So, once നമ്മൾ പേഷ്യൻറ്റിനെ പൊസിഷൻ ചെയ്തതിന് ശേഷം ഐ ഡ്രോപ്പ് ഇൻസ്റ്റോൾ ചെയ്യുന്നു. ഐ ഡ്രോപ്പ് ഇൻസ്റ്റോൾ ചെയ്തതിന് ശേഷം ലൂസ് കോട്ടൺ ഇൻസേർട്ട് ചെയ്യുന്നു ടു പ്രിവെന്റ് ദി ഡ്രെയിനിങ് ഓഫ് മെഡിക്കേഷൻസ്. Then replace all articles and wash hands. നമ്മൾ മെഡിസിൻ ഒഴിച്ചതിന് ശേഷം പേഷ്യനോട് പറയണം ഒരു 15 മിനിറ്റ് നേരമെങ്കിലും ആ പൊസിഷനിൽ തന്നെ മെയിൻറ്റെയിൻ ചെയ്ത് കഴിഞ്ഞാൽ അല്ലെങ്കിൽ പെട്ടെന്ന് അവർ എഴുന്നേറ്റ് കഴിഞ്ഞാൽ മെഡിസിൻസ് തിരിച്ച് drain ചെയ്തു പോകും. Then document the medications administered. Along with that, we should assess that whether any kind of drainage were present and what were the color of that drainage, whether it was infectious or not, whether any bad smell was there. So these are the things you should document. Then the special consideration, we should not, before going to administer or install an ear drop, excessive use of eardrops can cause irritation and inflammation of the skin and membranes of the ear. So before going to install the ear drop, we should make sure that we should administer in the proper amount. അതായത് എപ്പോഴും ഡ്രോപ്പ് ആണെന്ന് പറഞ്ഞാൽ പോലും നമ്മുടെ ഇയർ മ്യൂക്കോസ് വളരെ തിന്നാണ് അല്ലെങ്കിൽ വളരെ തിൻ കൺസിസ്റ്റൻസിയിലുള്ളതാണ് നമ്മുടെ ഇയർ മെംബ്രെയിൻസ് എല്ലാം. ഒത്തിരി ഡ്രോപ്പിൽ അല്ലെങ്കിൽ ഒത്തിരി എമൗണ്ടിൽ മെഡിക്കേഷൻസ് കൊടുത്തു കഴിഞ്ഞാൽ ഓട്ടോമാറ്റിക്കലി അത് ഇൻഫ്ലെയിംഡ് ആവും സ്കിന്ന്. Then do not place the medicine dropper tip directly into ear canal as this may traumatize the ear canal. ഒരിക്കലും നമ്മൾ ഡ്രോപ്പറിൻ്റെ ടിപ്പ് ഒരിക്കലും ഇയറിൽ ടച്ച് ചെയ്യാൻ പാടില്ല. ജസ്റ്റ് ഒരു ഹൈറ്റിൽ മാത്രമേ വയ്ക്കാൻ പാടുള്ളൂ. ഇവിടെ ശ്രദ്ധിച്ചറിയാം, ഒരിക്കലും ഡ്രോപ്പറിൻ്റെ ടിപ്പ് ഒരിക്കലും ഇയറിലേക്ക് ടച്ച് ചെയ്തിട്ടില്ല. ജസ്റ്റ് ഒരു ഹൈറ്റിൽ മാത്രം നമ്മൾ പ്ലേസ് ചെയ്യാൻ പാടുള്ളൂ, അല്ലെങ്കിൽ ഓട്ടോമാറ്റിക്കലി ഇത് ഇൻജുർഡ് ആക്കാൻ ചാൻസ് ഉണ്ട്. ഓക്കെ, സോ ദീസ് ആർ അബൌട്ട് ദി eardrop installation. I hope you got an idea regarding what is installation, what are the special considerations that you should follow while installing eardrop medications, and what is the position of the patient in which we can provide or administer the eardrop medication. Okay, so next we can discuss regarding the eye drop installation. Eye drop installation means it is a dispensation of a sterile ophthalmic medication into patient's eye. So ear drop installation എന്ന് പറയുന്നത് ഇയർ കനാലിലോട്ടാണ് മെഡിസിൻ കൊടുത്തിരുന്നതെങ്കിൽ ഐ ഡ്രോപ്പ് ഇൻസ്റ്റലേഷന് വി ആർ അഡ്മിനിസ്ട്രിങ് മെഡിക്കേഷൻസ് ഇൻ ടു ദി പേഷ്യൻസ് ഐ. ഓക്കെ, Then, what are the purposes of instilling eye drop medications? First is to dilate or constrict the pupil. To dilate or constrict the pupil. Before going to perform any surgical management, we should administer the prescribed amount of eye drop to dilate the pupil. Then, to act as an antiseptic solution to prevent any kinds of itching or redness from the patient's eye, we should administer some kind of antibiotic eye drops. Then, to act as a lubricant. Then, to relieve inflammation associated with any kind of infection, we should administer an eye drop. Then, to relieve pain and discomfort associated with any kind of infection, sometimes patient may be having severe pain in the eyes. So, to prevent or to relieve such kind of pain and discomfort, we can administer the eye drops. So, these are the purposes: to dilate or constrict the pupil, to act as an antiseptic, to act as a lubricant, to relieve inflammation, and the last one is to relieve pain and discomfort. Then next is the general instructions that we have to follow while administering an eye drop. Ensure that the proper drug is being instilled. We should make sure that we are administering the right drug to the patient, which means we should not use any kind of drug which has passed the expiry date. If you found so, you should change that medications and return with a good or a correct drug. Then some ophthalmic solutions may be contraindicated or can cause allergic reactions. Suppose if the patient had any history of allergic reactions to any kind of eye drop, you should not do it again. Then eye drop containers should be clearly labeled and checked before installation. Then only we can assess or we can counter check with the medication order. Eye drop should be monitored for discoloration or sedimentation. Before going to instill the eye drop, we should confirm that medication is not having any discoloration or sedimentation. If you found so, you should not do it, or you should replace with a good one, which indicate that ophthalmic solution is decomposing. In that case, a new dose of medicine should be obtained and affected body can be discarded. Okay. Then double check the patient's identification and chart to ensure the correct dose is being instilled into the correct. എന്ത് മെഡിസിൻ നമ്മൾ കൊടുക്കുന്നതിന് നമ്മൾ 10 റാറ്റ്സ് നമ്മൾ ചെയ്യുന്നത് പോലെ തന്നെയാണ് ഇത് ഐ ഡ്രോപ്പിന്റെ കേസ് ആണെങ്കിൽ പോലും. കാര്യം ഇവിടെ ഡ്രോപ്പ് ഐ ഡ്രോപ്പ് ആണ് നമ്മൾ മെഡിസിൻ കൊടുക്കുന്നതെങ്കിൽ പോലും we should double check the patient's identification to reduce the chance of error. Never touch the tip of the eye dropper to the patient's eye. ഒരിക്കലും നമ്മൾ ഐ ഡ്രോപ്പിനെ ടിപ്പ് ടച്ച് ചെയ്യാൻ പാടില്ല. കാരണം ഇത് സ്റ്റെറൈലാണ് നമ്മുടെ ഐ എന്ന് പറയുന്നത്. അല്ലെങ്കിൽ ഐ structures, ophthalmic structures can be considered as sterile, so you should not touch the tip of the eye dropper. Sterilization is an important part of the eye drop installation. നമ്മൾ ഒരു രീതിയിലും കണ്ടാവുന്ന നമ്മുടെ ഐയിലോട്ട് കൊടുക്കാനായിട്ട് പാടില്ല while doing that procedure. So next we can discuss regarding what are the equipment needed for delivering an eye drop installation. A medication tray containing eye drop. The prescribed medication should be taken in that tray and cotton swabs should be taken to clean the eye. Then sterile water in a bowl for swabbing. Then gloves and kitting. So these are the common equipment needed for delivering an eye drop. Next is the procedure. First, you should check the physician's order for assessing or for counter check with the correct medications, the correct amount, dose, and in which eye, where you need to be instill that medication. To obtain specific instruction to identify the patient, check the identification against physician order to fulfill the legal requirements, and wash hands and dry it before going to perform to prevent the cross infection, because we are instilling this medication into the eye, so it should be done in a sterile procedure. So that we have to clean the hands with soap and water, as well as we should maintain hands as dry. Explain the procedure to the patient, why you are going to perform this procedure, what are the indications for doing. In the previous slide, we had discussed regarding what are the purposes. So, you should provide a thorough explanation to the patients regarding the indications and purposes of doing such procedure, so that we can get the correct cooperation from the patient as well as to reduce the anxiety of the patient. Then ensure privacy to avoid unnecessary embarrassment and help the patient into a comfortable position. The supine position is very important position for delivering the eye drop installation. Clean the eye if discharge is present. For that we have to take the cotton swabs. Ask the patient to look upward and gently pull down the inner lid. First, after providing the patient in a comfortable position, that is supine position, we should tell the patient to look upward and gently pull down the inner lid to ensure greater exposure and better absorption. Then allow the patient prior to instill drops to prevent the fear and anxiety. Then hold the drop at about 2 centimeters above the eye. We should not touch the drop from the patient's eye and allow the drop to fall into lower conjunctival sac. That is the cavity into which we have to instill the eye drop. That is to the conjunctival sac to prevent the medications from falling onto the cornea. Ask the patient to gently close the eye, wipe excess moisture from the periorbital area. In case of an eardrop installation, we should tell the patient after the installation of that medication should not change the position after 15 minutes, isn't it? നമ്മൾ ഇയർ ഡ്രോപ്പിന്റെ കേസിൽ പറഞ്ഞായിരുന്നു മെഡിസിൻ കൊടുത്തതിന് ശേഷം 15 മിനിറ്റ് പേഷ്യന്റ് ആ പൊസിഷനിൽ മെയിൻറ്റെയിൻ ചെയ്യണം. ഐ ഡ്രോപ്പ് ഇൻസ്റ്റോൾ ചെയ്തതിനു ശേഷം നമ്മൾ പേഷ്യന്റിനോട് പറയണം കുറച്ച് നേരത്തേക്ക് കണ്ണ് അടച്ചു വെക്കാൻ പറയണം, അല്ലെങ്കിൽ നമ്മൾ കൊടുത്ത മെഡിസിൻസ് പെട്ടെന്ന് ഡ്രെയിൻ ഔട്ട് ചെയ്ത് പോകും. സോ ദിസ് ഇസ് ദ പിക്ചർ ഓഫ് ഹൗ വി കൻ ഇൻസ്റ്റോൾ ദി ഐ ഡ്രോപ്പ്. ഇവിടെ ഒരു ഗ്ലൗസ്, ഓക്കെ, ആരാണോ ഇൻസ്റ്റോൾ ചെയ്യുന്നത് a person should wear the gloves to prevent the contamination and tell the patient to look upward, as well as you should pull down the conjunctival side. So this is area into which we can install the ear drop. Okay. After the procedure, ensure the patient is left as comfortable and remove the screens. Dispose of all equipment appropriately to prevent the cross infections and document the procedure in which you can mention regarding whether any kind of drainage or whether any kind of discoloration present or whether any kind of kinds of infections present. Okay, recording abnormal findings. In aftercare, if patients are treated for infections or conjunctivitis, they should be advised to wash their hands regularly, or else it can cause contamination of that infection, or it can cause transmission. For contamination and transmission of infections, then avoid touching their eyes and avoid wearing eye makeup or contact lenses, and to discard any eye drop or eye makeup used before the infection began. Then glaucoma patients may using eye drop medication should be monitored to determine if the drops are effective. അല്ലെങ്കിൽ intraocular pressure increase ചെയ്യാൻ ചാൻസ് ഉണ്ട്. സെക്കൻഡ് ഗ്ലൂക്കോമ പേഷ്യൻസിന് ഐ ഡ്രോപ്പ് മെഡിക്കേഷൻസ് നമ്മൾ ഇപ്പോഴും അത് എഫക്റ്റീവ് ആണെന്ന് മോണിറ്റർ ചെയ്യണം. Many times the combination of drops is necessary to treat glaucoma. Glaucoma means it is an ophthalmic disorder in which the intraocular pressure is high. So till now we were discussing regarding the eye drop. What is eye drop? What are the articles needed for installing an eye drop, and what is the procedure? Okay, how we can position the patient, and what are the special instructions that we have to follow while installing a eye drop. Okay, I hope you got a clear picture regarding the two procedures. Okay, so next we can discuss regarding the remaining portion, that is nasal instillation. The definition is it is the medicine solution prepared for administering into the nase. So in which we are administration of nasal drops into the nasal cavity. So this is the cavity into which we can administer the drop. So this is a picture of all examples of some kind of nasal drops. Then which are the purposes of doing nasal drop instillation? To relieve congestion, to relieve any kind of nasal congestion associated with allergic reactions, and to relieve dryness, as well as to combat infections and to administer local anesthesia. So these are the main purposes of doing nasal instillation. Next is equipment. First, we should get a clean tray into which we should take sterile cotton ball or balls and buds. Box of disposable tissues should be collected, and prescribed nasal drops should be taken and should get a light source. The procedure is check the physician's order and progress note to obtain specific instructions. In that, we should check for the dose, then the expiry date should be checked, then identify the patient, check the identification physician's order. Then nursing action, to explain the procedure to the patient to win the confidence of the patient, as well as to get the cooperation from the patient throughout the procedure and ensure privacy to prevent or avoid unnecessary embarrassment. Then help the patient to into a comfortable position. Normally, we should provide a position that is supine position. Same as that of eye drop instillation, we can position the patient in supine. Position the light source, identify which nostril should receive medication. There is a picture of how we can administer the nasal drop. So, nasal drop. So this is in which patient is positioned in a supine position and head is down, tilted, and we can instill the nasal drop. Prepare the equipment, wash hands and dry it to prevent the cross infection. Have the paper tissues available to wipe away secretions and medications. Before going to perform the installation of nasal drop, we should clean the nasal nostrils. Otherwise, the medications cannot be absorbed well. Clean the patient's nasal passages using the cotton balls to ensure maximum penetration for the medications and get easy absorption. Then gently ask the patient to tilt their head. So in the previous slide, so tilting of head can help easy insertion or installation of medications. Then hold the dropper near the entry to the nostril and instruct the client to inhale as you drop the medication into that nostril. Now avoid touching the inner surface of the nasal cavity. You should not touch or you should not allow to touch the dropper on either side of the or inner part of the nasal mucosa. It can cause irritation or patient may get a feeling of sneezing. ഏത് nasal drop അത് ഡ്രോപ്പറിന് ഏതെങ്കിലും ഭാഗം നമ്മുടെ മ്യൂക്കസയുടെ മെമ്പറൈനിനകത്ത് ടച്ച് ചെയ്താൽ പേഷ്യന്റിന് സ്നീസിങ് ടെൻഡൻസി ഉണ്ടാകും. അത് അവോയ്ഡ് ചെയ്യാനായിട്ട് നമ്മൾ എപ്പോഴും ശ്രദ്ധിക്കണം. Because the patient to maintain a position for at least 1 to 2 minutes to get a full absorption of that medication and repeat in the other nostril. According to the doctor's order, you should follow that procedure. So this is the picture how we can install that nasal drop. In this picture, nasal drop is administered into the left nostril. Okay, then procedure in case of a nasal spray. Till now we were discussing regarding how we can install a nasal drop. We can also install some kind of nasal spray to relieve the congestion as well as to relieve any kind of infections. How the client sits erect with the head and nose upright and tilted slightly forwarded. Remove the cap from the nasal spray. Shake the bottle very well and gently place the tip of the spray bottle well into the nostril. Instruct the client to exhale and then inhale vigorously as you squeeze the bottle to deliver the spray. Repeat in the other nostril. Each patient should have his or her own medications and dropper to prevent the cross infections. So we can take their own dropper. Ensure the patient is left as comfortable as possible. Dispose all equipment appropriately and document the procedure and reporting abnormal findings, whether any kind of nasal discharge was there and whether it was having any bad odor or not, or whether any kind of trauma or whether the patient had any abnormal signs or symptoms while doing that procedure. Okay. Then aftercare. After rinsing the dropper or nasal spray tube with warm water, the cap should be replaced. Soil the tissues should be placed in a bag that can be sealed and discarded. When the procedure has been completed, the nurse should wash his or her hands to prevent the chance of infection. Then the special considerations that you should know while doing this procedure of nasal installation. Medicine can irritate the lining of the nasal membranes and mucosa and cause inflammation or nostrils when used in excess. So that we should not deliver the medicine in an excess amount because it can irritate the mucosa as well as it can lead into nasal bleeding or epistaxis. If excess of nasal sprays are used, the patient can develop functional dependence. എപ്പോഴും nasal spray നമ്മുടെ ഡോക്ടേഴ്സിന് ഓർഡർ അനുസരിച്ച് മാത്രമേ പ്രിസ്ക്രൈബ് ഡോസിൽ കൊടുക്കാൻ പാടുള്ളൂ. അല്ലെങ്കിൽ ഒരു ഡിപ്പെൻഡൻസി കൂടാനുള്ള ചാൻസ് ഉണ്ട്. The complications of nasal installation, but burning sensation, dizziness, disorientation, delirium, tachycardia, and difficulty in swallowing. Okay, so till now we are discussing regarding what is installation, what are the main forms of installation like eardrop installation, eye drop installation, and nasal installation, and we had discussed regarding what is the purpose of each installation and what is the procedure. Okay, then we had discussed regarding each procedure with nursing action with the rationale. I hope you got an idea regarding the procedure very well. So if you have any doubt, you can ask me directly. Okay, thank you.